Hello, friends. Welcome again. This is Dr. Kazmi, and you're watching my YouTube channel. Today, we would be again talking about COVID 19. And in today's episode, we would be talking about the COVID 19 testing, its positivity rate, and the current situation around the world. So, as of today, that is the 19th of June 2020. The total confirmed cases globally stand at around 8.5 million, and the total number of global deaths as of today stand at 457,190. And you can again see that almost all the countries are affected. It's mostly the United States of America, it's Brazil, European continent, especially Spain, Italy, United Kingdom, and then we have got current hotspots in South Asia and Middle East, where the number of cases are gradually increasing. So the total number of cases around the world has been increasing, but we have seen that the mortality rate is going down. At the same time, we have seen that the number of tests conducted to diagnose COVID-19, they are on a constant rise, but the positivity rate is gradually declining around the world. Though there are certain countries where the positivity rate is going up, but if we take the global average, the positivity rate is overall coming down. So it means as more tests are being conducted, less and less people are testing positive. So it generally feels like we are gradually on a slow decline as far as the global morbidity and mortality is concerned. Now, I will show you a figure from the United States of America. And here you can see this shows that the number of tests conducted since beginning of March till date, they have gradually increased over the period of time. So at the moment, there are around 500,000 tests being conducted in the United States daily, on a daily basis, to diagnose COVID-19. And this blue line is actually showing the positivity rate. So the positivity rate gradually increased in late March up to the mid of April, and the positivity rate went up to an all-time high of 22-23%, and then it has been hovering around between 20 and 24%, and then since end of April, it's been gradually going down. So you can see as the number of cases are increasing, the number of positive rate is going down, and at the moment, the positive rate is around 5%. So we are hovering around 5% in the United States of America. It simply means all of the 100 tests that are being conducted at any given point in time, at the moment, only 5% of those tests, they come out positive for COVID-19. So it seems like the positivity rate in United States of America is on a decline, though there are other certain countries where the positivity rate is still quite high. And I will show you what the WHO recommends in this particular case. So this is, if you look at this diagram, this is actually showing the daily number of tests conducted as a percentage of population or as a ratio of population. And here they show the daily number of tests per 100,000 population. This is showing the all-time average for different countries. On the y-axis, this is the positivity rate. So it simply means that out of all those 100 tests that are conducted at any given point in time, how many of them they turn out to be positive. So you can see that for certain countries like Brazil and Peru, which are South American countries, the positivity rate is quite high. So for Peru, it's around 30%. For Brazil, it's somewhere between 30 and 40% of all the tests. And they are at the moment doing around 16, 17,000 tests per day. So ideally, if you are doing more tests, your positivity rate should go down, because you are actually increasing the denominator, and that would actually dilute the numerator depending on the prevalence of the condition. And we know that the COVID-19 is not a very highly prevalent disease. It is attacking special segments of the population, especially the elderly one. And that's why you would see that the prevalence is quite high in certain high-risk groups. But overall, the prevalence as a general percentage of the population is quite low. So still we need to have very high testing in order to dilute that. So if you see some of the countries like Iceland have been doing very high number of tests, like their number of tests has gone up to probably 160 tests per 100,000. population. While if I come down to Pakistan, so this is Pakistan. So in Pakistan, the number of tests being conducted at the moment are quite low. So on average, we are doing 4 tests per 100,000 population, which is quite low by all standards. And the average positivity rate is 14.46 of all those 100 tests that are being conducted in Pakistan. 14 to 15% of them are coming positive. So out of every 100 people who are being tested, around 14 and 15 are positive for COVID-19. And the average daily confirmed cases a few days back was 1,000, which has jumped up to around 5,000 per day these days. So the WHO recommends, if I go down, if you see here, the Pakistan has got a positivity of 14.46%. And the WHO has recommended that if your positivity rate is less than 5%, then it probably means you have got COVID-19 under control. And it simply says that if you look here, that looking at the positivity rate, that is out of all tests conducted, how many come positive for COVID-19, this is the most reliable way to determine if the government is testing enough. And a high rate of positive tests simply indicates that the government is only testing the sickest patients who seek medical attention and is not casting a wide enough net. So again, if we apply this analogy to the case of Pakistan, so you would see Pakistan has got a very high positivity rate, that is 14.46, which is more than the 5% cutoff level given by the World Health Organization. So it simply means that the testing is not wide enough, and only those who are quite sick, who are being hospitalized, only they are being tested. It's probably mild cases or asymptomatic cases, those who are on the lower side of the spectrum, they are not being tested. So as I said earlier, that the WHO has issued guidance stating that the government should see positivity rate below 5%, and that should be for at least for 14 days before they should start considering relaxing social distancing measures. Similarly, at the same time, they say that testing programs should be scaled to the size of the epidemic, not the size of the population. So if you think like more people are being affected, you should scale up the testing of the population, and more tests should be conducted. However, there is no expert consensus like how many tests should, or how many raw tests should be done per day. So anyhow, but as the WHO has given recommendation that your positivity level should be less than 5%. So if you test more and more, this figure should ideally go down. Fine. Okay, so let's move forward and talk about some of the theories why this positivity rate has gone down in certain parts of the world. Well, there are different theories behind that. One of the theory is that basically whenever there's a pandemic, there is always a high risk segment of the population, and these are super spreaders, so they get infected and they actually spread the infection, and usually the mortality is high in that particular group. So that is the first one to take the hit. So over a period of time, when that high risk group is subtracted from the population, either they become recovered or they simply die because of the complications, then the rest of the population, which is not that much vulnerable, what happens is that it's very difficult for the virus or for the bacteria to infect them. Or even if they get infected, they're quite asymptomatic. It's not easy for them to spread it to the rest of the population. So over a period of time, the incidence and the prevalence goes down. So this is one theory which seems more plausible, as we have seen that those parts of the world which were worst hit, it's steadily going in a decline, while the other parts of the world which were not actually affected in the first phase are now seeing an increase in the number of cases, and that's steadily growing up, and it's following the same curve that we saw in the developed world. There are some other theories as well, that some people, they say that probably the virus has mutated into a less harmful strain, but so far research has not proven that this virus has mutated into a low strain. So this is all speculation. The third thing is that probably the treatment is quite effective, though recently we have got a good sort of a breaking news in the form of that dexamethasone actually works quite well in those people who require intensive treatment. And before that, there was different speculations, different hypotheses that came about hydroxychloroquine. Then we talked about azithromycin. Then there was research about remdesivir. Some of the trials were, some of the actually research studies were retracted as well. So there was a lot of confusion. So there have been trials, and errors. And in certain parts of the world, certain drugs have shown some promising results, while in other parts of the world, it hasn't shown. So I think only time would tell which of the treatment modalities have actually worked once this pandemic is over and we look at the data in retrospect, or maybe we have got good studies which can be meta-analyzed to reach some conclusion. So as I said earlier, that probably one theory is that probably we now have a bit better understanding of the pathophysiology of the disease, and we are in a better position to fight it off, and probably that is leading to a reduction in mortality. And more than that, I think perhaps one of the other reasons that has caused a decline is the public awareness and good practices of social distancing and good personal hygiene methods, especially in the developed world, where people are quite conscious about these things, and they have practiced all these methods, these preventive methods, social distancing, which was supplemented by lockdowns and forced closure of the businesses. So that has also helped in controlling the spread of this virus, and we are seeing a decline. At the same time, the capacity of the system has increased, so more and more tests are being conducted. But as I said, like because of the social distancing, because of the increased public awareness, the incidence and the prevalence of the virus has gone down. But still, in some part of the world, where there's poverty, where there is ignorance, where there is a lack of education, and there is a lot of overcrowding, which is coupled by the fact that there's been no proper practice of social distancing. We are seeing a steady increase, and as we saw in the case of Pakistan and India, where the cases are gradually increasing, and probably they would reach a plateau, and then we might see some form of herd immunity, and then it would probably go into a steady state and then slowly and gradually decline. So these were some of the theories which have been put forward as a sort of a case for why the global morbidity on mortality is going on a slow decline. So thank you very much for listening to me. Do subscribe to my channel. If you've got any questions or queries, just put down in the comment section below, and I will try my level best to answer as soon as possible. Thank you very much. Bye.